Doctors have warned that the nation is facing the collapse of bulk billing in general practice, with many surgeries forced to charge gap fees to all patients as clinics face a financial tipping point, pushing some towards going broke. A large proportion of general practices that had offered bulk billing have begun writing to patients to advise they can no longer continue such consultations. Joining me now live is the new Vice President of the Australian Medical Association, Dr. Danielle McMullen. Thank you so much for joining us this afternoon. Firstly, can you give us an idea, why is this happening?
Yeah, look, we've been saying for a long time now that general practice, the viability of general practice is in crisis, and it does feel like that crunch time is approaching. The cost of providing care is much higher than the Medicare rebates available to patients. In fact, the Medicare rebate only represents about half the cost of providing a service. And so when we bulk bill and we accept that Medicare rebate as the full cost, as the full payment, we are really taking a 50% discount on the cost of providing that care. Now, general practices have been trying their best to support our most vulnerable patients, and we do everything we can to run our businesses efficiently and to try and make sure our most vulnerable patients pay the smallest out-of-pocket possible. But after many years of tightening our belts, there's just no more we can do, and practices are really struggling to make ends meet.
The federal government has recently moved to set up a strengthening Medicare task force. What reforms are needed here to improve the system across the board?
Yeah, we really welcome the nearly $1 billion in funding to general practice over the next few years and look forward to working with government on some of those reforms, things that will do new mechanisms to make sure that we reward high value care and take care of our chronic and complex patients better. We recognise that this is just the beginning. There's likely to need to be more funding to make sure that patients can continue to access primary care and stay out of hospital, because even with much more funding, we know that general practice remains the most efficient part of our health system.
There is obviously a GP shortage. It's been a significant problem for some time. Is that a factor contributing to this at the moment? And why aren't medical students turning to general practice?
Workforce is definitely a significant issue affecting our profession. It used to be that about 50% of medical school graduates were interested in a career in general practice, and unfortunately that's now dropped to 15%, and we're already not filling our GP training places. So we've got a problem now and a growing problem into the future. I think the reasons behind that are complex. All of this talk about the struggles we face in general practice certainly isn't a great advertisement to medical students. So we are trying to do our best to say that it really is a rewarding career, but it needs more support from all levels of government to make sure that it's financially viable for these doctors who train for many years to be specialists in the field of general practice.
I guess people hearing this might be quite concerned as to where bulk billing is going into the future. So many people do rely on bulk billing. How many GP practices do you believe have gone down this route where they simply cannot survive anymore?
At the moment, we are still seeing that about 2/3 of Australians are bulk billed all of the time that they go to the doctor, but everyone else is paying some out-of-pocket fee at least some of the time, and I expect that to grow. It's hard to know exactly how quickly or how broad that change will be, given, as I said, that all of us on an individual basis do our best to try and minimise the costs that our patients face. We've got to recognise that to continue providing high-quality care as our patients become more complex with more chronic disease, we really do need more funding, because the current Medicare system was built many decades ago and structured around very short consultations for acute problems, for short-term problems, and it's just not structured to help us take care of people with more chronic and complex disease.
Just finally, Doctor, you've just been elected Vice President of the Australian Medical Association. What do you hope to achieve in that role?
I'm really looking forward to the role our President, Professor Steve Robson, and I have primary care and general practice on the top of our priority list, working initially on the Strengthening Medicare Task Force, but across all levels of government to get primary care accessible and affordable again. And along with that, we've got work to do in private health insurance and our public hospitals as well to make sure that the health of Australians is front of mind for governments across Australia, and we can continue to provide the excellent healthcare system that we have in this country.
Dr. Danielle McMullen, we have to leave it there. Thank you so much for joining us.
Thanks for having me.